once I have the experts here, I'll be welcoming them. Dr. Isaac Nyako Kwache. He happens to be the program officer, Send Ghana. And Mr. Mohammed Mumuni, regional programs manager. And also a friend to the station as well. For us to learn more about So basically, we're going to learn more about social protection. And I'm sure once we have our knowledgeable persons here, they'll give us a brief background into it, what actually motivated this move, the objective behind it. Well, one thing I learned back in communication school also is the skills or the methods used in arriving at getting a particular information. So we're going to get through all the methodologies as well as what actually are the findings, and if there are any headways to make recommendations. I'm sure our very knowledgeable guest will be able to do justice to it. So without my time to say, let me quickly welcome my able guest in the person of Dr. Isaac Nyako Kwache. Isaac Diamiamidin, and also Mr. Mohammed Mumuni. Well, Mr. Dr. Isaac Nyako Kwache happens to be the program officer, Send Ghana, and Mr. Mohammed Mumuni, regional programs manager for Send Ghana. And so, gentlemen, without much to say, good late afternoon, good evening actually to you both, and I'll urge you to kindly get closer to the microphone for us. Good evening.
Good evening.
Good evening, YAD, and good evening to your listeners.
All right, thanks a lot. Welcome to Asase Radio 99.7 FM. I hope you are well.
Great, thank you.
Doc, you like the place?
I love the place.
You went beyond like to love. Interesting.
It's a fantastic place.
That's great. Sure. So tell a friend to tell a friend.
Definitely.
Anyway, so basically social protection. Yes, we mostly at times hear about the flagship programs like the LEAPs and all of that, but how well do we know the concept of social protection and all the matters surrounding it? Then we now get into the research actually. So any of you can begin with it. Us.
Great. So thank you very much, YAD, and once again, good evening to your listeners. As he said in the introduction, we are coming from SEND. And SEND Ghana, we are noted for our public policy research and advocacy work, and that we do to promote good governance and the equality of men and women in Ghana. And in this regard, our work on social protection forms part of our public policy monitoring and using that as the basis for our advocacy work. So basically, we want to influence government policies in the social protection subsector in order that we can be able to address the development challenges of this country. So basically, social protection, as you said, is not a new concept. It's a concept that globally all countries have adopted, and using that as a means to be able to address development gaps, especially issues of inequality, but also poverty. And I think in our part of the world, one of the foremost reasons why our governments have come up with social protection programs is to address issues of poverty.
All right, great. One day. And obviously, this conversation will mean well to our audience because most of the youth actually are connected to this, and the working class as well. So we'll get to find out more on this social protection. From today's presentation, I learned a lot. Still some gaps in social protection delivery, and we'll get to know more about the current or the number of these programs we have, and delve into it much, and how they contribute to national development, or how they should have done better. So, let's get straight into this research and then tell us about the objective of it.
Right. Thank you very much, and good evening to your listeners and everybody hearing us. The basic idea for this research, and as it was stated earlier, we all some way somehow need social protection, and since the launch of the Ghana National Social Protection Policy, which led to the identification of these 5 flagship programs, the NHIS, LIPW, capitation grant, school feeding, and what have you. We realized that most of the assessment and evaluation of the report has been from the government side. And you can attest that civil society organizations and non-state actors actually play a significant role when it comes to some of these policies, because we will be able to tell government what is doing right and what is not doing right. So that actually led to the development of the social accountability framework, which served as a tool for monitoring and evaluating all these 5 flagship programs. So basically, the main idea behind the mirror report is to serve as a complementary report to that of the government, so that we compare the two to see where the gaps are, the balances and checks and balances, to ensure that we get an effective social protection program. So basically, the mirror report is also giving a different picture from the perspective of the beneficiaries and those enjoying the program, rather than the government perspective. Thank you.
Okay, you are very precise and concise right there. So how did we actually arrive at this research? What went into it? What methods did we go through to arrive at what we've gotten at the moment, and how comprehensive it is?
Yes, when you look at, initially I made mention of the social accountability framework, and the framework is made up of 3 parts: the independent budget analysis part, the input tracking, and the community scorecard. And these were the areas that we assessed. And in terms of participants, we actually selected participants from the 10 traditional regions, and we actually took their views on the program. The independent budget analysis actually looked at the budget allocations as far as social protection issues are concerned. So that was more of a secondary review of literature into government budget document and other published document. Then we had the input tracking. The input tracking actually assessed the logistics that are needed for the delivery of the program. And with the logistics, we actually took the views of key informants at the district level, that is the district officials for the various programs. And the community scorecard was actually used in order to gather data from the beneficiaries. So it was more of a focus group discussion where citizenry were asked about various aspects of the programs and how they view it. So if you ask me about the methodology, this is and it is purely more of a descriptive sort of study, because we needed the participant to tell us their experience with the programs.
Oh, okay. And to you, was it satisfactory?
Let me allow you to.
Yeah, so thank you very much. I think that in terms of methodology, as he said, we try to look at 3 comprehensive approach. That is both the beneficiary side, those who are benefiting from this intervention, and also implementers, but also looking at the budget. Well, it's raised a number of issues. From where we sit, I'm sure when we begin to share the findings, our listeners can judge whether it's satisfactory or not.
Okay.
But of course, there were differences between what citizens think or beneficiaries of those interventions if you compare that with the scores from implementing agencies. So I think that when we zoom directly into the findings, then we can people can begin to appreciate exactly what the issues are. So if it would allow me, I would want to delve directly into the findings. Yeah, so
sure.
I mean, as he said, we looked at 5 key social protection programs, or even like interventions that are very key in our social protection policy. And the foremost thing that we found, which is very critical and cutting across all the 5 interventions, is the fact that government spending on social protection actually is less than 1% of our GDP. Now, if you compare that to the sub-Saharan average, which is about 2.2, you will realize that we are not doing very well as a country. But then it kind of gives us a picture why we have challenges with a lot of these interventions currently. So give me one single social intervention that we are not facing challenges with as far as funding is concerned. I mean, talk about the Ghana school feeding program. Caterers are always, chasing for payments. Payments of caterers is always in arrears. The inadequacy in terms of what is allocated per child. At the moment, what is allocated per child is about 97 pesos, less than 1 Ghana cedi. Yet the caterers are expected to cook a nutritious meal, hot one of course,
a balanced
diet of course, with meat and then also some protein. In this case, egg. How much is an egg now? There's the issue of leave beneficiaries. Leave beneficiaries are supposed to be paid. A household is paid 64 Ghana cedi, not every quarter, every 4 months. Let's ask a basic question. In Tamale, how much is a bag of maize in the market now? Well over 200 cedis, right? And then you give a whole household 64 Ghana cedis. And even that, in most cases, is in arrears. Sometimes up to like 8 months, they won't get, any subventions.
Very meager amount.
Yes. Even though the amount is very meager, even the release is a problem. Talk about the national health insurance, which is even much more better because our analysis has shown that in terms of allocation and releases, the national health insurance seems to be better. But that we are not surprised because we have a national health insurance levy, okay? And there's a fund. The only challenge that we have found with this research, and is known to all those who are following, our budgets and expenditure, that not every amount that is mobilized from the National Health Insurance levy and our SNIT contribution actually gets lodged into the National Health Insurance Fund. Now, that accounts for the lot of challenges we have with health insurance as far as reimbursement of claims, the fact that we are still not able to take on board a lot more diseases, but also drugs that the health insurance should cover. So there are a number of issues that have come up. As I said, the fact that we are spending less than 1% of our GDP, which is, not up to the sub-Saharan average. There's the issue about the rampant delays in the release of the money. There's the issue of the inadequacy of the money. The cash grants, I've spoken about the LEAP. I mean, the 97 pesos for, people's under the Ghana school feeding program. So there are a number of issues raised in this report that actually, requires a lot of attention, especially at the national level. I'm sure my colleague, Doc can add on the findings.
All right. Yeah. So in case you just tuned in, you're still live on Asasi Radio 99.7 FM here in Tamale, and we're having a very important conversation that really matters to all of us as citizens of Ghana, and basically is on Send Ghana and CSO partners coming out with their launch of the Social Protection Mirror Report. As I said, very insightful, enlightening to all and sundry. And I'm here with Dr. Isaac Nyako Kwachi. He's a program officer, Send Ghana, and Mr. Mohammed Mumuni, regional programs manager, making sure we have a very comprehensive understanding in all of this. So, Doc.
Yes, just to add to what Mumuni initially indicated. You see, even as part of the budget, we realized that there were some huge variations between the expenditure allocated and what actually was released. You could see some variations there in one program and a particular year. You realize that they got less than 50% of the allocated amount, and that variations could hamper a good and efficient delivery of the project. When you look at in terms of logistics, the input tracking at the district level, most of them had issues. Some of the districts, and comparing districts in the north and those in the middle and southern belt, it was realized that those especially in the north had issues with logistics. And that will clearly tell you that we are widening the inequality gap. And it's a matter of a more critical issues that must be looked at in future. And as CSOs, it's one of the things that we'll be looking at. But we need to look at a fair, equitable distribution of logistics in order to ensure effective delivery of the social protection programs. When you look at the community scorecard, where the people and even some of the district officers were rating the program, generally it gives a fair rating. By fair rating, an average rating. Our ratings were more of bad, just okay, good, and very good. All the programs had just okay.
So it cuts across.
Just okay.
Not too pleasant an answer.
I mean, if you just say just okay, my beer management business management teacher said quite okay is as good as not okay.
Mambia sir. So teacher.
Oh yes, I'm with teacher.
See, na ya wo mami bia ya tone wa che sheda nko yesa but when your friend Mambia sir.
You be father sir. A yara. That's what they are saying. A yara. So generally it's not good.
Much room for improvement.
Yes. And it needs more improvement in order to, especially when it comes to the payment releases. It was an issue that cuts across, and in some of the programs, even some of the officials will tell you that these findings are actually what pertains on the ground.
Okay, so
let me just add on the findings as well. One of the issues that came up, which is something that requires attention, is also the heavily politicization of social protection programs. I mean, the fact that we are not using a very transparent targeting approach. Even though we have spent a lot of money, we got money from the World Bank to do the Ghana Household Registry. And the essence was for that to be able to provide us a database so that we have a sense of those who are poor, those who require support in our system. That is completed. I'm very much sure it's completed for the northern sector. I'm not too sure whether the process has been completed throughout the country. But that database was supposed to help us to be able to properly target those who should benefit from social interventions. Unfortunately, both from the national through to the community level, the process has been heavily politicized. Take the case of LEAP. In fact, people that should be on LEAP are not on LEAP. Those that are better off and shouldn't be on LEAP are currently on LEAP. Once in the community, you are the party secretary, you are the party what, your relatives, people that are aligned to the party. And we are not talking about this government. It's been so from one government to the other. If a community is not aligned to your political party, it is most likely that it won't be on the Ghana school feeding program. There are a lot more communities, in the rural communities that are not on the Ghana school feeding program. But others where they even prepare the food and the kids don't eat. The reality is that what they eat at home is better than what is prepared in school. Yet at the village level, anytime they prepare food is our day. Because what they get in school is even better than what is prepared at home. So, but let's ask ourselves, why did we institute the Ghana school feeding program? It was meant to increase enrollment in areas where we have children that should be in school that are not in school. So why are we not using an approach that allows us to be able to properly target? You see, and the fact that we are not doing that, we are wasting resources, and is a reason for us not achieving the objectives of some of these programs. The reality is that despite the numerous social protection intervention in this country, the inequality gap is widening. We are not making progress as far as extreme poverty is concerned. It is because we are not looking at the inequities or the inequalities that exist in society. Tell me one single intervention that looks at the gaps between, for instance, rural and urban, north and south, men and women, aged, the youth, children, persons with disability. We use the same brush to paint everybody. You see, and that makes it difficult. When you assume people are at the same level, you implement an intervention, and then you create the impression that people are at the same level, they should struggle to, take advantage. There is no way you can bridge that gap. And if we are not making efforts to address inequality, there is no way we can address poverty in this country. So social protection programs in this country are not really targeted. But the broader issue is how is government also, working to make sure that, for instance, LEAP beneficiaries. Why wouldn't LEAP beneficiaries be rolled onto the planting for food and jobs as a way of improving their livelihoods to even graduate from being LEAP beneficiaries to being independent? Mm-hmm. That person is already identified as a poor person. Some of them they are able people that can, be engaged in farming, but he cannot raise the subsidy that government requires. Is it not possible that such people can be? So how do we ensure integration and complementarity? So that person who is poor, the child needs education, they need health, so the child should attend a school that is being fed. The child should have access to health insurance. So it should be complementary services. Otherwise, the way we implement social interventions in this country, it is not well coordinated. Thankfully, now we have the social protection policy. We still don't have a law. Okay. So at the moment, we are raising these issues, but we don't have the basis to take government to court for committing less than 1% of GDP. If we were to have the social protection policy, law, which says that if government commit less than this, then citizens can demand accountability and, for that matter, responsiveness. At the moment, that is a challenge. But even where the law is clear, take the case of national health insurance. We mobilize from the national health insurance levy. Not everything gets deposited. How many of us, civil society and ordinary citizens, have seen the need to take government to court for not doing that? I think that if we are to make progress as a country, we need to begin to see how do we, better demand responsiveness. There's a lot said by civil society and the media, but we don't seem to see anything changing.
Very true, because many a times with this school feeding program and all of that, we as citizens rather feel, look, we are being cushioned by the government. It's a kind gesture. You get it. But I feel from your submission and learning a lot, we are entitled to it.
Yes, just to add to the issues of targeting. Mm-hmm. You see, when you meet the implementers, they will tell you that, oh yes, we have a fantastic system in place that enables us to select the right people.
Kindly, just before we wrap up, in case you have some comments, WhatsApp number is 0205 241431. 0205 241431. You send a text message, a regular SMS, or better still, a WhatsApp message 0205 241431. Thank you.
Yeah, so just as I was saying, in terms of the politicization, we shouldn't always look at it from the macro level perspective. Down there, the grassroots, there are politics going on there. And as you indicated, most of the citizens do not know it is their right. And as part of this project, the project that gave birth to the Mayor Report, we are aiming at right-based approach to social protection. Our main aim is to tell the citizens that social protection is a right. Don't see it as a government official just giving you an opportunity to enjoy a LEAP program, to enjoy a school feeding program, to just be part of the labor-intensive public work. It is your right as a vulnerable person. It is your right as a disadvantaged person. So government is not doing us any good. So for that reason, political parties should not simply use these things as a campaign message and just gross over it, get people to vote for them without doing anything. Once we begin to recognize that it is a right, then we'll be able to demand from the implementers and the suppliers what actually must be done. Because if I go to the hospital and you are charging me for what I am not supposed to pay, I should be able to question you. Perhaps, fortunately, I will be able to question because of maybe my status or other thing. But somebody out there in my holy village may not be able to question because that person will see even the hospital facility as an opportunity of being there. And some of these issues do not just end with our report. When you take previous reports that we have published, you could even realize that citizens are only know that some of these programs are just a privilege that the government is giving. So by this means, we are telling the citizenry that it is not a favor that the government is giving you. And because of that, when you go to the community and you go and complain about it, the fear is that they will take you off from the program so they cannot talk. But it is high time they recognize that it is their right and they will demand for the right thing.
All right. So I'm sure in your submissions there are a couple of recommendations already in there, but I don't know if you would want to touch on some very key ones before we wrap up on all of what we've heard with regards to the performance of social protection initiatives and all.
Yeah, so thank you very much. I think that we have built the recommendations around the specific or like the main findings. The first recommendation is that we are calling on government to increase its spending on social protection. I mean, we raised the issue of the less than 1% of what we spend from out of our GDP on social protection, which is less than the sub-Saharan average. So we're calling on government to commit more resources as far as social protection is concerned, even if we cannot reach the continental average is about 6.8. At least we should be doing the 2.2, which is the sub-regional.
So it should be 6, and we are at 1.1, right?
Yes. We don't know. For now, we are doing less than 1%.
Wow.
But the sub-Saharan average is 2.2.
Okay.
So it means that our neighbors that are close to us are doing around 2.2 averagely. So government needs to step up. And the problem we have is that we do not have a dedicated fund and funding source for social protection.
And that brings me to the question before we wrap up. So how do we get the Ministry of Finance and other stakeholders to actually commit properly to this intervention? Because there are many times we find those women who cook for these vulnerable people crying out loud for money, owed them for months, some even years. And so how this is a question from Rex. So how do we get
so that's what I was saying, that to address the funding problem, we need to be able to establish a fund, a social protection fund, and a dedicated funding source. At the moment, we don't have that. So if we're able to establish a dedicated social protection fund and then indicate the funding source, where the money is going to be coming from. If we say, for instance, this percentage of our oil revenue, the ABFA, is going to be, going into that fund, then that is clear. If there's going to be an introduction of a new tax, if there's going to be a percentage of what has been introduced now, e-levy, all of that will be stated. The challenge we have now is the fact that there's no dedicated fund and the funding source is not clear. So it is as and when. The only one that has a dedicated funding source is the NHIS. Yeah. And that we are saying that is even abused. The fact that not all that is mobilized. So again, we are saying that in the case of the NHIS, government should try as much as possible. Whatever is mobilized from the NHIS levy and the SNIT contribution should be lodged into the NHIS fund.
All right.
Doc so can pick up on the rest.
All right. So
just a quick one.
Okay.
In terms of the strategy, I think we must avoid wastage and unnecessary spending. Monies must be channeled to the right source.
Quotas.
And we must prioritize social protection. And in terms of another one that I'll say is, once we have the law in place, so we are calling on the ministry to ensure that the bill is sent to AG and for subsequent submission to Parliament for its passage and assent by the President. So basically, this is what we are saying.
I think lastly, the issue of politicization. We need to depoliticize social interventions in this country.
Yeah.
I mean, we have made some progress in terms of establishing clear guidelines and criteria for selection. Let's try as much as possible to follow that and use that as a basis for selecting or determining who benefits from the interventions. Otherwise, I mean, we can have a dedicated fund. The funding is released, but if the right people are not those that are benefiting, we wouldn't see the impact of these programs. Poverty and, for that matter, inequality would continue to be an issue. And so the issue of targeting it's something that government must pay attention to.
All right. Okay. So this has been a very enlightening conversation. I'm sure a listener or some listeners out there who probably missed out on our earlier submissions, is there any medium through which we can get this report and follow keenly or get much understanding into?
Yes, you can get this report on our website, www.sendwestafrica.org. You can explore that. You'll get all the reports, and not just this report, but everything that we have done on the in the area of social protection, and some other areas are there that you can access.
All right.
And we can even leave one with you, so that if anybody is interested, could come for the book and just take the executive summary to look at it.
All right. So basically, the report is accessible via www.sendwestafrica.org.
You can also get that on the UNICEF's website. UNICEF that is supporting this.
Oh, okay, great. All right, so Dr. Isaac Nyako-Kwache, Program Officer, Send Ghana, Mr. Mohammed Mumuni, Regional Programs Manager, many thanks for coming our way with this comprehensive education. I wish you the very best of the evening.
Thank you so
much. So just to say that we will not stop with the report lunch. We are going to be having engagement at the national level, engaging with Parliament, the Ministry of Local Government, Ministry of Finance, all the relevant access at the national level, in order that we can be able to use that to influence government. Otherwise, then it will just add up to the numerous reports that have not achieved anything. So there's going to be a lot of engagement at the national level to make sure that we push government to be more responsive as far as social protection is concerned.
All right.
And so we want to call on the media, especially this particular media house. You've worked very well with us in SEND, and we look forward to engaging much more better. So we want you to commit to sustaining these discussions within your media space over the next 2 weeks, even if it means for us to create space and come back. I think that if we can sustain the discussion, we are more likely to get the attention of government.
Very true. All right, so more grease to you already grease the elbows.
Thank you.
Thank you.
All right,
and thanks for the opportunity.
Anytime.